In a groundbreaking development that might cast a shadow on the burgeoning success of certain weight loss and diabetes drugs, a recent epidemiological study has pointed toward potential health risks associated with these medications. The study, published in the research journal JAMA, has suggested that drugs like Wegovy and Ozempic, commonly prescribed for weight loss and diabetes management, might be linked to an elevated risk of 3 serious stomach conditions in non-diabetic patients, News.com has learned. The conditions highlighted in the study include stomach paralysis, slows or completely stops the movement of food from the stomach to the intestine and can cause symptoms like persistent vomiting, bowel obstruction, blockage of food passage through the intestines, and pancreatitis, inflammation of the pancreas. While warnings about pancreatitis and certain types of bowel obstruction are already included on drug labels, stomach paralysis is not. This revelation is causing concern among healthcare professionals and patients alike, as these treatments, known as GLP-1s, are gaining popularity in the United States for their capacity to induce significant long-term weight loss. GLP-1s function by decelerating the digestive process, which aids in curbing a person's appetite. However, complications can arise if this deceleration becomes excessive. GLP-1s have come under heightened scrutiny as some patients have reported cases of stomach paralysis and instances of suicidal thoughts while using these medications. This research, conducted by the University of British Columbia, is the first large-scale study to assess the risk of these severe stomach conditions in non-diabetic patients using GLP-1s for weight loss. Prior studies had focused on diabetic patients, who are generally more susceptible to such conditions. The researchers aimed to examine these risks independently of diabetes, a condition which itself increases the likelihood of stomach paralysis and pancreatitis. But it's crucial to understand that the risks appear to be rare. The study found that about 1% of people taking Ozempic were diagnosed with stomach paralysis. Mohit Sadi, one of the study's authors, emphasized the significance of the research, saying, "We wanted to take diabetes out of the equation because millions of people around the world are using these drugs to help them lose weight." The study analyzed health insurance claim records of approximately 16 million U.S. patients, focusing on individuals with a history of obesity who were prescribed semaglutide or liraglutide between 2006 and 2020, excluding those with diabetes or those prescribed other diabetes medications. Although most patients in the study were prescribed liraglutide, the researchers believe the observed risks could extend to the entire GLP-1 drug class. Comparing GLP-1s to another weight loss medication called bupropion naltrexone, the study found that GLP-1s were associated with a 9-fold higher risk of pancreatitis, a 4-fold higher risk of bowel obstruction, and a more than 3-fold higher risk of stomach paralysis. These findings suggest that the risks of these conditions are higher for patients specifically taking GLP-1s compared to those using alternative weight loss medications. Sadi highlighted to CNBC the significance of these findings when scaled to the population level, stating that, when you have more than 1 million people taking the medication worldwide, that's 10,000 people who could potentially experience gastroparesis according to the incidence rate for semaglutide. It's rare, but that's still a lot of people. The researchers also noted a higher rate of biliary disease in patients taking either liraglutide or semaglutide, although this difference was not found to be statistically significant. The study's authors hope that their findings will help healthcare providers educate patients about the potential risks and benefits of taking GLP-1 drugs for weight loss, emphasizing the importance of informed patient consent in making medical decisions.